Good afternoon. Lots of people slowly trickling in, which is nice to see. Just let people have a couple of minutes. I think in total we're expecting about 30 people, so we're probably about halfway there at the moment. A few key people who I'm hoping are going to help me answer some questions, so I'm absolutely going to wait for them. It's tricky when diaries are full and people go from one meeting to the next all day. Still waiting for a couple of key people, so we'll just give a little longer. Principally waiting for Mark, as it happens. He's a very important person in all of this. Okay, well, we'll make a start and we'll talk about how the rest of this session is going to go, and then Mark and a few other people that I'm waiting for can join us as we go. So this is the Q&A webinar as part of the Wessex SDE Data Access Scheme, which is currently open. We are going to record this webinar this afternoon and host it on Wessex Health Partners website, along with the remainder of the information about the call. And we will document a Q&A document to go with that for people that don't particularly want to just sit and watch the video. I have put in the chat the link to all the wider information, which can be found on the Health Partners website, including the application form. And just a reminder that the closing date for applications is Friday, the 10th of July. So the purpose of today then is to allow people who are interested in making a submission to the call to ask further questions, further details, and to get some feedback from members of the SDE, from the data team, and from our partners in CIRU around the scheme, what we're looking for, data sets that we've got available, and how the scheme might run over the next couple of weeks. There are lots of people on the call. It's always challenging when you're doing a Q&A session to see all the hands. It's particularly challenging in Teams to understand when people put their hands up, whether the conversation is part of the same conversation or whether they want to ask a new question. So please do use a combination of hands and madly waving at me if you think that there are things to add to the conversation. There are lots of people and people might come and go during the session. So I'm not going to introduce particular people, but I will ask people when they put their hands up or when they're being asked to speak or answer a question, if they just briefly introduce themselves, if they haven't done so already, to give an answer to a question. I might also, if there are lots of questions, excuse me, and if some of the conversation becomes very specific or detailed, I might suggest that in order to move things along and give a broader range of questions, so that some questions are continued offline. There is always the Wessex SDE email address after this event to ask any questions subsequent to today, or any further details or clarity on anything that you might hear today or as part of the call. Okay, I'm still waiting on Mark. Excellent. So I'm going to kick off just and ask a few key people in the SDE team to have a couple of minutes to give slightly wider context to the scheme. So I'm going to come to you, Mark, first and ask if you can just tell us very briefly a little bit about the SDE and this particular scheme in particular.
Yeah, sure. Thanks, Rachel. Hi, everyone. I thought I'd use a couple of slides, Rachel, if that's okay, to describe what the SDE is. So I've got a couple here just to share for those who are not familiar with the SDE previously. Um, so I guess the first thing to know about the SDE is our mission and vision, and very much tied to this data access scheme as well. So the SDE exists as a service for researchers, and we want to enable impactful research that's targeted on improving patient outcomes and returns value to the NHS. And our vision and this data access scheme and the work in here is obviously part of building towards this vision, is that we want the Wessex SDE to be England's leading regional test bed for linked, so linked in other words, primary care, secondary care, multimodal data, linked longitudinal and that multimodal data, enabling research and AI that improves care. So obviously the data access scheme tightly aligned to this, trying to make that impact from data assets in the SDE. I guess the other thing to know about the SDE is that it's part of the Department of Health Policy now that NHS data sets move into these secure data environments. So here in Wessex, we are one of 10 regional SDEs around the country. We've been up and running for about a year. We've accumulated some data in there already that you would have seen in the data access scheme, for example, the cards data set and Prana and others. And the whole idea here is that the NHS uses these SDEs as a place where we can bring data in, land it, and invite researchers to come in and do their research on it. As researchers, you may bring your own tools, you may bring your own data as well, and that you can take result files from this environment, but never the row-level patient data. You can see the row-level patient data inside the SDE, but you can never take that out of the environment. And I guess the last thing to say is that the Wessex SDE is part of a much larger network, not just the 10 regional SDEs across England, but also now with Health Data Research Service, HDRS, there's the potential here to work with the 4 nations on data assets as well. So for this data access scheme, right now we're focused on just Wessex data assets and Wessex researchers, but there's obviously potential for your research to start to work with other SDEs in future as well. So I hope, just as an introduction, Rachel, that's helpful for the audience.
Thank you, Mark. Do you want to, are there a couple of questions or a couple of things that you'd like to say about the purpose of this call?
For the Wessex Data Access Scheme itself? Yeah. So I think the original purpose of the call was to make the most of the data assets we already have inside the SDE. So after 1 year of operations, we've already been able to amass a certain set of data in the SDE, and you'll see that in our data capability register, and there's a link to that in the call. As we thought about this scheme and thinking about the value it could add, not only are we interested in research that can make use of existing data assets, but we're also interested in researchers who could identify additional data sets that could add value to the SDE as well. It's unlikely that each individual researcher will control that data asset. The control of that is probably with the trust or with the business intelligence team, for example. But having you as a researcher give that sort of demand signal to us and therefore to the trust will hopefully encourage more trust to contribute more data to the SDE. So on the one hand, the scheme is about making use of data assets already there. On the other hand, it's also about generating more demand for research data to land in the SDE and giving us then, as SDE people, the remit to go to trust and say, look, this is a researcher here with this amazing idea. Please tell us what it would take to land that data. And for some data partners, it's, we'd love to do that, Mark, but we don't have the resources, in which case we fund resources at that trust. We've done that with Hampshire Hospital, for example. There are different reasons why trust may or may not want to share the data with the SDE straight away. But again, having your research be an extra source of demand is super helpful to us and therefore part of this call.
Brilliant. Thank you, Mark. I'm wondering, Kai, if we come to you briefly next, if you want to just briefly introduce yourself and talk a little bit about the existing data resources that we've got in the SDE.
Sure. Thanks, Rachel. Nice to see you all. I'm Kai. I'm the tech and data lead for the SDE. So there were two things I wanted to talk about. The first thing is what data are actually in the SDE, and the second aspect was about the bring your own data, which you will have seen in the funding pool. So what data are in the SDE? The first thing to note is that the SDE is not currently a data warehouse of all raw data from UHS and from all other hospitals across Wessex and GPs and so on. Although there is an ambition to start to shift towards that when it comes to common key data sets that are used in sort of multiple projects all the time. Rather, over the last few years, there are a number of projects that we've supported. And for those projects, we've prepared these big data sets, research grade data sets, and they've been shifted into the SDE. And so what the scheme is doing is essentially advertising those data sets again for reuse. So there are already research projects that are using these data sets. They're designed for a specific research question, but there are a number of other research questions that can be asked of them. So that's the first thing to note. And I thought rather than me just talking, it might be good to share my screen and show you what you may have already explored, but explain a little bit about how this works. So advertised on the Wessex SD website is the Data Capabilities Register, which is essentially a shop window, if you like, of the data sets that are already in there. And over time, that might grow to encompass kind of key warehouse data from different trusts, from GP, from community mental healthcare trusts, and so on. But for the moment, it's primarily reflective of the research projects that have been done. And so what you can do is you can essentially browse through these, and these are the data sets that are available. So if I look at this one here, you've got viral hep, and there's a lay description about that covers some sort of key metadata around what that data set looks like. The most useful thing, though, is this data dictionary, which you'll see. So if I pull that up, here we go. And the way to interpret this, so there's a sort of brief information around coverage. So for viral hep, we have 4,600 patients. We have the inclusion-exclusion criteria about how that cohort is defined, and then the data that we've collected for those patients then reflected in the other tabs here. So here we've collected data from 2003 around 4,600 patients. The tables should be fairly self-explanatory. If you imagine a big Excel file, each of these could be a sheet, for example, each of these could be a CSV file. But there's a lot of data packed into columns. So for each of the tables, so we have here the demographics table, you'll get a sense of each of the columns that exist within that table and what it looks like in terms of data type, length, and so on. And really, the only thing I wanted to show here is that the column descriptions give you a little bit more information about what those data represent. And you've also got these enumerations, which specify where data are encoded, what the encodings actually mean. So just to cover this very quickly, if you're looking at laboratory tests related to the viral hep data set, you're going to see a bunch of test codes, and these would be the descriptions, the names, the names that help you to decode those. So that's all I thought might be worth showing there. I'm sure lots of people have already explored all of this. The second thing I was going to note then is bring your own data. So when it comes to bring your own data, there's a governance process for this application, which I think is going to be discussed. There are the data sets that are already staged there, but there may be instances where additional data could help to answer new research questions. So to give you one example, we've got a research project ongoing at the moment, which is looking at deterioration, factors that contribute to deterioration of patients within a hospital that's traditionally measured by News 2 score. And this is a huge data set with outcome measures, including sort of being shifted to ICU, unplanned move to ICU, cardiac arrests, and obviously death. And for this project, the researcher is also interested in the effect of air pollution in Southampton and the effect that can have on exacerbating acute respiratory conditions. And so for that, we've got all this wonderful sort of open source data, and we're collaborating with other organizations in Southampton that collect this to look at wind direction, air pollution on given days, and then the effect that could be. So this isn't data that's collected by the NHS or by the UHS as a hospital. It's data that's collected elsewhere, but we can bring that into the SDE to sit alongside to enrich the data set, if you like. And the methods of this, methods of how we bring this data in, I won't go into it from the technical perspective because it's probably not that interesting. But in terms of the application phase, if this is listed, additional key data sets that you would want to bring in, this is then assessed by the data access committee, the panel, which I think there'll be a bit more of a discussion about, to check that those data are essentially safe to come into the SDE. And by safe, we generally mean doesn't increase the re-identification risk of patients, right? So as long as it's not sort of additional patient data there. There are, I think, in a few instances, the ability for the SD to consider whether the data set could be tweaked slightly. So these data sets are all the outputs of what the Data and AI Research Unit have prepared in the past. But if there's a really good case to bring in some additional data from other locations, and so to reconfigure the code bases to produce those, then I think that's going to be considered in a few cases as well. But yeah, I think that's it from me. Happy to answer any questions. And
thank you.
That's helpful.
Thank you, Kai. I think the ultimate ambition of the Wessex SDE is to build an exemplar data research facility for Wessex. So we're interested in having any wider conversations with individuals around further data sets that aren't currently listed, but might be useful in the future to create that data facility. Michael, George, if I can just very briefly, I'm mindful that I want to get on to some Q&A session, but if you can very briefly sum up the data governance process for us.
I can indeed, Rachel, thanks. Hi, nice to meet you all. I'm Michael, I'm the Data and AI Clinical Fellow on the team. I will keep this brief, and governance is important, and I think we want to make sure it's done, but have a brief process as well. So hopefully this will kind of demonstrate that it is a kind of brief, somewhat streamlined process. I am just faffing around trying to share my screen at the moment. Give me a second and I will put something on. In fact, I won't do that. In fact, what I'll do is I'll share an image that just kind of talks you through the process. So I'll put that in the chat. So basically, the governance framework just allows us to use the data responsibly, make sure that we're kind of using the data in a transparent and efficient way. Really, if you can see the diagram I've just posted on there, everything kind of starts with a research question. And from that research question, you can start to shape the study. I guess this is a little bit different, or potentially a little bit different, because you've got a catalogue of data to start with. So you could kind of do it the other way around. You could look at what the data looks like and then form a research question from that. But ordinarily, we would start with a research question. Once you have that research question, you can start to shape the study, what are the aims, what are the objectives, and the endpoints, and what data you'd actually need to answer that question. And so that's where the first step in our kind of governance, the real first step in the governance kind of comes through, which is this DARF, which is the Data Access Request Form. Now, essentially, all this is a key document that kind of captures all of these things. Effectively, it will capture your project, your aims and methodology, the analysis, purpose of the study, what data is needed, who needs access, and then the outputs that are expected. So that's really probably the kind of the most important piece of kind of documentation that we'd ask our applicants to fill in to tell us everything about the study. And it kind of hopefully allows you to think about the study as well and guides you through that process of what the study should look like and what the data should look like. So once the DARF is completed, that's Data Access Request Form, the applications then will go to a Data Access Committee. And so that's, we call that the DAC. We'll have DARF and DAC and all sorts of other acronyms. But the Data Access Committee is a group comprising of a mixture of public professional members that reviews the applications. And their role is to make sure the projects can sit within the remit of the Wessex SDE, and all the kind of governance checkboxes have been ticked, and crucially, the data is actually appropriate for the proposed study. So we don't want to get to the point at which we're in the Data Access Committee, and then it turns out the data is completely off in terms of answering the research questions. So obviously we'd want to have those discussions with you guys before we actually get to data access committee. But effectively, all of those things are kind of ticked off at the data access committee. Once we get the okay from the data access committee, then there is a kind of small bit of practical governance work to complete, which includes organizational onboarding and user setup. At the moment, from a user setup point of view, the requirements are for a CV to be sent, and at the moment, a GCP, good clinical practice, but that might change to be something that a little bit shorter to fill in. It only takes about an hour or so, but that's kind of it. Really, it's the DARF is the most important bit, getting that data access request form in, and then once it goes through the data access committee, a few bits and bobs to finish off before the whole process is complete.
Thank you, Michael. And I think that one of the advantages that we're hoping of coming through this scheme and using the SDE delegated authority from PAG and REC is that all the governance steps should be fairly streamlined and fairly quick. So we are keen to get researchers face to face with their data as quickly as possible so that they can start to do the work that interests them. Ha, I know you're on the call. I wonder if, as our CIRU partner and hoster of our SDE platform currently, if you very briefly want to introduce yourself and very quickly talk about the platform.
Yeah,
give you 2 minutes.
Yeah. So hi everyone. I'm Ha. I'm from the CIRU Clinical Informatics Research Unit. So basically, we as a unit offers data management, storage, and analysis to collaborators within the Wessex SDE. So I can show you what it looks like. So it's easy for you to imagine what you as researchers can have access to. So let me know if you can see my screen. So basically, the Wessex SDE provides data analysis within a platform called BC Insight. And this is accessible via an Azure virtual desktop, which is what you're seeing here. And so if you go into the desktop and enter this URL, which is only accessible within the SDE and not anywhere else. So you will see in this UI, all the data sets that you have access to. So it depends on your, as Michael mentioned, the data access request form, what you have request access for. In this case, I'm looking at the IVD synthetic data. So you can see what the table and what the data looks like. And don't worry, these are all synthetic. So you can have demographics, diagnosis, etc., etc. And then how do you actually analyze all these data sets? That's when you go into workspaces. And this is your designated workspace. A lot of things you can do in here. First of all, if you look at cohorts, you can create, if you're interested in a certain cohort, a certain group of people. So let's say you're only interested in female patients who are elderly with a IVD category of CD. You can do that and then add different visualizations. For example, this box plot showing surgery time by ethnicity. And then we also support analysis in coded forms, so Python and R. So if you go into notebooks, and then this is an example of a Python notebook, you will extract the data. This is the dataset ID, and then put it in here to load the data, and then conduct your analysis as normal. And then once everything's done, you would potentially like to extract these for demonstration or for publication purposes. Then you will send in a request to us, which will bring to our weekly access review meeting, where we look at the files, making sure that there's no personal identifiable data, and that we're happy to extract that for you. So that's just a quick look at the SDE, but I'm happy to take questions if you have any.
That's lovely, Ha. Thank you very much. And I think it's nice to see inside the environment, and also nice to understand that there will be help and support for any researchers who are successful with their projects to get to understand the environment, to get to understand their data and get to know what they can do with it. So that's a brief introduction to the scheme, the SDE, the availability of the data and the SDE platform. So the remainder of this session then is to help and support potential applicants and answer any questions that people might have. So if anybody wishes to go first, be brave, put your hand up, ask us a question. Carolina. You're on mute at the moment, Carolina.
Again, hello.
Okay, thank you.
I have a question related to how it works if I am bringing my own database for you in terms of data governance. For example, I need to sort this out before applying, or is something that will be decided after if I'm successful with the scheme?
Okay, that's a good question. I don't know, Mark or Kai, which of you might like to answer Carolina's question?
Yeah, maybe I'll try first. Kai, just thinking through the question. So in this particular case, who is the data controller of that data?
Is the of Portsmouth?
Portsmouth, okay. So the SDE has signed data sharing agreements with every trust in Wessex, which gives us the high level or top level governance to allow files to move across. In Portsmouth's particular case, we also wanted to do something called a data protection impact assessment because UHS has done one, Portsmouth wanted to do one, so we're just supporting that right now. So for that particular example where it's trust data, trust of the data controller, this will be covered by data sharing agreements that those trusts across Wessex already have with the Wessex secure data environment. In terms of the timing of that or anything else, I think because we're expecting a lot of applications, it'll be very difficult for us to spend all the time evaluating every single potential data set. So from my perspective, I'd encourage you to write that up in the application, to be very clear about who that data controller is. Is it the trust or somebody else? Maybe it's a council or it's dental data. I know somebody's talked about dental data, bringing that in, so who would be the data controller there? And as part of our evaluation, when we look at this every application in detail, we might come back to you with a few questions at that stage. But ahead of the submission deadline, I'd encourage you to just document the data you would like to bring in, the data controller of that where known, any contacts you have that might help us get quicker access to that data. That's the helpful stuff. Carolina.
Well, the dental data is me. So.
Oh, fantastic. Great.
I made the question.
Super,
Thanks.
super duper. And I think, I don't know, technically, Kai, if you want to talk about landing a researcher's own data in the SDE, or I guess you kind of covered that earlier, but anything else, Kai, from your perspective?
Yeah, sure. So I guess most of the data sets that have been sort of discussed are data that exists in the SDE and essentially access can just be switched on after the application process, right? In terms of bringing in an entire new data set, there would be two ways to do it. I won't think it would be tedious if I went through all of the sort of nitty-gritty of the technicals. But essentially, we can either do a little bit of work with your analysts, if you have analysts on your side or someone technical who can pipe the data in, we can work with you so that you can pipe it directly from Portsmouth in there. Another option would be a slightly less techy route where we can land it in an airlock and then do some jiggery-pokery with the data within the SD to make sure it then fits into the database tables, right? So there may be a little bit of cleaning that would need to be done because it has to fit into specific database tables with primary keys, with no duplicates and things like that. So we could either do a bit of work with you to do that on the Portsmouth side, to help that sort of happen on the Portsmouth side, depending on the state of the data at the moment, or to kind of land it in and do some engineering work within the SDE. In terms of whether this is all covered by scope, covered by the scope of the funding core, I'd defer to Rachel there on that one. Not to put you on the spot, Rachel.
Thank you, Guy. I think with all of the applications, there will be a degree of further conversation, support, information sharing that has to happen. But in terms of this particular call, I think we're primarily looking at the range of research, the quality of the research question, the uncovering of new areas and innovation of things that we're doing with the data, looking at particular priorities perhaps across Wessex. So we would encourage anybody to either come back to us for questions before the call through the email, or we will happily have those conversations afterwards when it becomes more detailed and more nuanced. But please do consider putting your applications in. And even if applications are not successful in this round, then you will have opened the doors to further conversations. And the SDE is keen to have conversations with everybody across Wessex as we build this world-class data facility for everybody to use in the longer term. Thank you. Thomas, you've put your hand up with a question.
Yeah, so just sort of going on that a little bit. So again, I'm talking about bringing in data. So I'm in a unique position where we're setting up a regional network across Dorset, Hampshire, Isle of Wight, ICB, which is incorporating community services, primary care and secondary care delivery of services. And we have existing data sort of lying in that field, but within part of that, we're also collecting new data going forward, respectively longitudinal data sort of moving forward. So in terms of a call, obviously, you want to be using existing data sets, but how much capacity is there to bring in new data as well moving forward? Obviously, you know, we've got a potential to bring in a huge wealth of data in the future, and doing that within a secure environment would be obviously advantageous for future research in my field.
Excellent, thank you very much. Mark, I wonder if you want to start to address Thomas's questions.
Yeah, great question. So you mentioned a few things there around community care and primary care data as well. And primary care data has come up quite a few times in clarifications that have come into the Wessex SDE email over the last couple of weeks. The situation with primary care and the SDE right now is this, that the ICBs, both Dorset and Hampshire Isle of Wight, have signed data sharing agreements with GPs, and we have almost 100% coverage across the GPs for data sharing agreements. However, when those data sharing agreements were signed between the GPs and the ICBs, it was explicitly stated that it would not be for research purposes, unfortunately. So we, as the Wessex SDE, are now in the process of going back out to all of the GPs in across Wessex, so about 204 or so of them, and signing them up to a data sharing agreement that would allow their data to flow for research. We've spent so much time with local medical committees, and we've now got to the point where the data protection officers responsible for all of the GPs across Hampshire, Isle of Wight and Dorset have recognized the data sharing agreement template that we have and endorsed that to be signed by GPs. But we are only on around 6 GPs out of the 200 that we've signed so far. So for this particular call, we're saying we can't link to primary care data for now, unless you have some other governance or some other way to do that. We just won't have the GP data in time. But to Rachel's point, we're hoping that this is the start of many calls in the future, whereas that GP data starts to be signed, the data sharing agreements that allow research to happen, we can offer that to future calls. In terms of community data, maybe talking about Hampshire Isle of Wight healthcare data and also Dorset Healthcare University. So both of those organizations have signed data sharing agreements with us. We have really good engagement with both of them right now. So I'd encourage in your application to make mention of data sets from both of those organizations that you feel would be useful to yourself and other researchers. And, memory clinic data is entirely important to dementia research, for example. So we're already talking to them about that. So yeah, please, that is more possible for this call. Please do mention other data sets as specific as possible from those 2 community mental health trusts across Dorset and Hampshire, Isle of Wight, and we'll evaluate that once we see the application.
Lovely, thank you.
Thank you. And I think this call is part of a 2-way conversation. It's as useful for us as members of the wider SDE team to understand what data researchers would like to have access to in the future. So if we see this as part of those conversations, so that we know what your areas of interest are and the data that will help you answer those questions in the future, and then that's a very good benefit for all of us at this point. Holly, you've got your hand up with a question?
Yeah, thank you. It sort of links from what you've just been saying. So I'm a clinical academic, so I'm based at the university, but I'm interested in data held by Dorset and Hampshire Isle of Wight. But I've had a look at the application form, and it's very much about which colleagues would help and time frame. So I suppose my question is, how much do you expect me to have had those conversations with the trust, or is it put the application in and then we have the conversations yeah, about how to access the data and time frame, and because I don't know.
Yeah,
Very good question. I'm sure Mark will be only happy to answer.
A very fair question, and the challenge is we don't know either about timeframes, and that's part of the this call. If a research can be done with existing data assets, great, but invariably researchers understandably need more data. What this will help us do is take even more cases to those trusts to say, look, there's a bunch of research here. And even to Rachel's point just now, here's commonality in the data sets. If we can land these 7 tables, we'll be able to do these 9 studies immediately. So again, as we get all these requests in, please be as specific as possible about the data sets that you require from the various trusts you require. If you have connections there already, have a conversation, great, tell us about that in the application. If you don't have the conversations there already, we have connections into those trusts as well, and we'll take that forward with you. So again, having been through this once or twice before, if we spent the time before application researching every data set and every data field, we just, in the team, we don't have capacity to do that. But if it's data from a trust, if you can be specific, we can start to line up many of the applications and say, there's a set of data here that makes sense across a wide number of researchers, so let's load that. So yeah, onus not on you unless you have prior contacts there. Just be specific, link to our mission and vision and everything, as we said, and as we review the applications, we'll follow up with more detail.
Okay, that's really helpful. Clinical links, but no links to data within the trust. So thank you.
Of course, yeah. But again, those clinical links are so critical. Sorry, Rachel, for us to encourage those who do have access to the data and who can send the data. You know, a local clinician could help with that sort of demand generation as well.
And I think as part of the call, we do ask applicants to get their application signed off by a member of their own trust to start building those connections, and so that no applicant is working in isolation. Part of this is about building that community and bringing people together to resolve some of these challenges across Wessex as we build all these different data sets together to support everybody. And it's easier when you've got a name to be able to do that. Thank you. Really good question. Natalie, you've got your hand up.
Yeah, thanks. Hi, everyone. So I think some of the SDE guys on the call know me. I'm Natalie. I'm a geriatrician and a researcher, and have been PI on the CatchNet study. I had a couple of questions. The first one was to Mark around whether there was sort of data sharing agreements or discussions with the local authorities around social care data, and what that looks like, and whether that might be within scope to try and explore that with this. And then I'll save my second question.
Yeah, great question. So there's a couple of studies that have a couple of prior SDE and BRC studies that have pushed us on this. One study comes to mind with NIDA as well that you might already be aware of. We don't yet have data sharing agreements in place with the local authorities. We have no feel for how long that might take, but we recognize that social care data is of high interest to lots of researchers. So again, in that particular case, I would say please add it to your application if we see a lot of demand generation for those councils. For some of them, we need to do it anyway as part of a prior BRC study, but I can't guarantee that data will be available for a call because we've not navigated data sharing agreements with local authorities yet.
Cool. And then my second question was, so I'm interested to know whether it's in the scope of the call essentially to try and link. So I'm interested in linking community hospital at home data in relation to the CatchNet data that's already in the SDE, and whether that's in scope around sort of trying to explore data linkage. And I guess the the question around that is that community data, we really don't understand what that's like in terms of quality and completeness. So we probably wouldn't have sort of very formalized research questions in terms of answering that data. The research question is more around the feasibility of understanding what the completeness is, at looking at pathways of care for people, which is sort of really important in terms of service evaluation and workforce modelling for complex older people who are moving across the urgent care systems. So yeah, I just didn't know whether you are looking for projects that have a very neat research question that you want to answer of the data sets, or whether or not it's in scope to think about using this as a way to explore linking data.
So again, I'll have an attempt at that. Maybe Kai or Michael can join me, and Rachel as well in the answer. So I guess there's two things there, aren't there? There's the nature of the research question itself, and the importance of that research question. And of course, that will be one of the criteria. We judge everything by what's the impact, patients, policy, etc. To the point about linked data, we have already linked some data together. So famously, the CARDS data set, which is on the Data Capability Register, and others. The SDE exists to link data together. But again, until we see new data sets from councils or anywhere else, we have no idea of the work effort required to link that data. So I'd encourage in the application, if you need data to be linked, please do mention that if you don't see it already linked from our Data Capability Register. But again, that'll be a follow-up conversation we'll need to have with the data owners. When will that data land? How complex is that data? What will it take to actually link it, etc.? But the fact that you need the data to be linked is an important signal to us and should definitely be in your application form.
And just to address your point, Natalie, on the slight difference between a specific research question and scoping data as part of potentially feasibility more than research. I think if you can link that feasibility type question to a Wessex priority or one of the SDE priorities, all of which are in the application document, then I think that would help your application demonstrate its future value, even if intrinsic value now in terms of a specific research question is perhaps not as easy to do. But again, I would encourage everybody who is thinking along these lines to apply, because you don't know how many applications there will be. We don't know the quality of the applications, and we're looking to use this to open as many conversational doors as possible. So I think you would come out with some useful information if you carried on with your application anyway. Vikram, I can see you've got your hand up.
Thanks, that's really helpful.
Thank you. I can see you've got your hand up, Vikram. I'll come to you in just a moment. Kai, you had your hand up briefly in that and then took it down again. Was that as part of an answer to Natalie's question?
That's very astute, Rachel. I can eagle. Yeah, hey Natalie. I was just going to add. So in terms of linking data, so one of the nice things about the SD is that it has CAG-REC approval that allows it to essentially provide delegated approval. That gives it delegated authority to provide approval for studies, as long as those studies adhere to the overarching protocol that the SD has itself, right? So what that means is any NHS organisations within Wessex, the SD has approval to be able to do sort of identify the intersection of cohorts from different sites. So to take some data from Hampshire Isle of Wight, to take some data from UHS, to take some data from Portsmouth, for example, and work out which patients are shared by essentially distributing those patients back to them, combining that and then informing all of the hospitals what the shared cohort is, just to give one example. So any studies that sort of fit that model using NHS data can essentially will not need to apply for CAG or REC, and can just apply to the SD itself to give approval at the Data Access Committee, which runs once a month. Now, that only applies to NHS data, so we don't currently have blanket approval from CAG-REC to do the same sort of thing with local authorities. So we do have a study at the moment where we have got CAG-REC approval to do that, and the local authority, which is Southampton City Council, are on board, so we're in contact with their analysts to essentially do this exchange and work out which patients are shared in the most secure way that we can, back and forth. So it can be done, but it's a sort of ad hoc thing per project. Obviously, it's slightly outside of the data sets that currently exist already in the SDE, but I think, like Rachel said, if it opens up a conversation for research that we could do in the future, then yeah, it'd be great to outline.
And I will just add to Kai's point that the set data team and the CIRU team are an amazing group of data engineers who love a knotty problem. So if you can provide them with a challenge, they will certainly accept it and work with you to try and answer that in the best way possible.
Not too knotty.
Oh, come on. I'm picking you up now. Vikram, you've got a question for us.
Yes, thank you. Hello. Suppose if I wanted to have 3 data set, if one data set is having a range between 2017 to 2026 and another data set we have wide range, do we need to map within the range across the data set?
It's a great question. Kaya or Michael, I don't know if you want to take that one. I have some first thoughts.
Happy for you to kick off, Mark.
So I suppose that comes to linkage, right, Vikram? Linking across time and longitudinal data. I mean, ideally, to link the data, there's a perfect match across the age ranges of the input data sets. But we know that's not always going to be the case. So again, I would just encourage you in the data application form to be clear about the data sets and the ranges of the data itself, with the understandable caveat that you'll only see linked data for the ranges that overlap across those data sets. So it seems like Michael wants to come in as well.
Yeah, Vikram, I just wanted to clarify that I understood the question. Are we talking about trying to link data sets using date ranges in lieu of having a better way of linking them through a direct identifier like an NHS number, or have I completely misunderstood?
No, the question is, say, cards data set, I realized this is available between 2017 to 2026, March. Say, if, for example, hospital episode statistics, which is having quite 10-15 years of data. So if I'm going to use a cards data set, so in that case, I need to have a range between 2017 to 2026 so that the other data will be separate and the analysis will map between these two data sets. So that is what my question is.
Yeah, and as Mark's mentioned, that's it's certainly possible. You just need to know
to have those things.
That what those data are and it can be done with.
Okay, thank you. I have one more thing to ask. What sort of data set we have in joint strategic needs assessment? Because this was recommended earlier.
Kai, I don't know if you have an answer to that question in terms of data availability.
Could you repeat that? Sorry, Vikram.
Yes, it is Joint Strategic Needs Assessment, JSNA.
Joint Strategic Needs Assessment. Is that part of the application?
No, I think this was recommended last time through some mail exchange. That is the reason I have written this to ask, because it is not there in the data registry. Just wanted to clarify what sort of data sets this will have.
I'm not sure. I'm
That's
gonna have to hold my hands up and do some Googling there, I think. Yeah, apologies.
That's fine. Mark, have you got thoughts on?
I think I can, and Vikram, I think this was maybe an email exchange we had as well, I believe, or with somebody else asked about JSNA, yeah, as well. So that seems to be a requirement from you around landing the JSNA data into the SDE. Is that correct? Yeah. Okay. So when we had that exchange, whenever that was, last week or recently, I did try to Google. So the JSNA, I believe, is held by the local authority. Is that correct? It's a data that's controlled by local authority. Okay. So in that case, the answer is similar to a previous answer, which was that we don't currently have a data sharing agreement with our local authorities in Wessex. But with this JSNA data and the other data that was referred earlier for social care, any data like that, again, if there's enough people asking for this as a clear signal of demand across the system, we'll go in and try to engage the local authorities with our data sharing agreement. But because we've not navigated that before, we just don't know how long that's going to take. But please include that in your application. It shows to us that data is valuable for you and hopefully for multiple others as well.
Thank you.
Hi, have you got something to add to that?
I can add, so I'm now post Google. So the JSNA is held by the Data Observatory and Southampton City Council. I can say that Southampton City Council are essentially sort of up for collaborating on projects. There's one project already that they're keen to work with us on. There are a couple of, like I mentioned earlier about, the ethical approval and so on, that would have to be study specific rather than just being able to use the SD's current ethics in place. But the team there are certainly want to work with the NHS and with the SDE on these collaborations. So yeah, if it's Southampton City Council, I think that's fantastic. If it's, I think it's Southampton, right?
Yes, it's Southampton.
Okay, fantastic. And then Hampshire Council, Hampshire County Council, I'm not sure that we've had any kind of direct contact on certain projects with, so to have a sort of relationship built up there just yet. That might be wrong. There may be people that have, but yeah, Southampton City Council, there's definitely sort of, contacts that we have there. They want to work together on projects, so it'd be a really good candidate for a research project, but potentially not something that can be covered by this call if it does need independent ethics and so on, but still, worth talking about for sure, I'd say.
Yeah. And if we do have research applications who want to go down the route of having independent HRA, CAG and REC approval, we're happy to support some work to be able to do that. It's not always the quickest pathway to follow, but again, we would encourage people who have specific reasons where that might be a better pathway to still fill in the application form and have those conversations with us. Thank you, Catherine, for joining us. I'm glad to see that you found it useful. Does anybody else on the call have any wider questions? Can't see any hands at the moment. Kajan.
Hi, I'm Kajan. I work for the Thames Valley West Critical Care Network. We don't actually do any research. We're very much more data based. So, this is all really interesting for us, especially knowing critical care is one of your kind of priorities. Can I ask about access to, I suppose for us, it's the national audit. So all of our units, our patch covers Thames Valley and Wessex, but certainly focusing on Wessex, they all submit to ICNOC, which is a national audit. Is that something you can kind of get your hands on, I suppose, is what I'm really trying to say, because we have a massive question. The holy grail for us has always been what happens to critical care patients once they leave ICU in the community. Hearing very much what you've said about community data might not be available now, so it may not be a question for this round, but it's certainly something we'll be keen to explore going forward, because that is one of the massive questions we ask ourselves nationally up and down the country. What happens to our patients? We just don't know. But I'm aware to kind of get that, the national audit data is probably the starting point, as well as obviously primary care data. So just keen to understand, is this something which can be done?
I believe this is a subject close to Mark's heart just at the moment, so I will let him answer.
It is, and just to confirm, you said ICNOC,
yeah,
right? Yeah, okay, perfect. So, so we should definitely. Please send me an email to the Wessex SDE email address. I'll definitely link you with another researcher in Hampshire Hospital. You might already know Irina Grecu.
Oh, I know Irina well.
Yeah, okay. She asked me the exact same question this morning about ICNOC data. So it's not an organization that we have a data sharing agreement signed with. It's not an organization we've worked with before. So same caveats as was mentioned with the local authority. But if it is an independent organization and data controller of that data, it gives me some hope, more so than other nationally held data sets, which when they go through a DARS application, with NHS England, for example, early days of this Wessex SDE, we asked for our own slice of some national data assets, being logically HES for all of the trusts that contribute HES data, NCRAS files, all the National Cancer Registry files, and also GP prescribing information. Those are three key data sets. We thought, let's start with that from NHS England. It was November 2024, we applied for that access. We're still waiting for our own slice of those data sets. So that takes a long time, even for us, NHS to NHS. But if ICNOC is its own data controller, its own organization, starting a conversation with them about the data sharing agreement, very happy to do so. So please, please send an email and maybe together with Irina, we can make a pitch to them. Or if you already know Irina, have a chat and let me know who at ICNARC we should send our data sharing agreement to.
We've got good contacts at ICNARC, and our data analyst who's also on the call, she does get her own anonymized version of the data, but I think we know for future, we want probably that core data. And it could be that the trust can provide all that data anyway, but it seems cleaner to just get it from ICNARC if possible.
Absolutely. Yeah, we reuse an existing pipeline wherever possible for sure. So.
Brilliant. Thank you.
Excellent. Thank you very much. I can't see any further hands up at the moment. But while people have a few final thoughts and rack their brains for anything that they want to ask, I'm going to put Matt on the spot and ask Matt, as a clinical academic and as the SET data theme lead, and someone who has supported many of these data studies over the few years, I wonder if there's any advice you would like to give to applicants in terms of how they prepare their research question, how they match it to their data, and how to be a successful applicant in these types of calls.
Yeah, happy to
Sorry,
come
I
in
am putting you
quickly.
on the spot.
No, you are putting me on the spot. That's okay. I think the main thing is start with the end in mind. So think about what you're trying to get out at the end of the project, how long you've got to get there, and plan backwards from there. And I think if you have that kind of mindset, then it makes the whole process a lot easier. And kind of what Vikram was saying about the cards data and where the time overlaps do or don't occur, that kind of thing. If you've got that clearly in your mind at the beginning, then you're much more likely to succeed and get out of it what you want at the end. Yeah.
Thank you, Matt. And I think the ultimate aim for all of this is using clinical healthcare data at scale to improve patient care. So if there is a clear line in terms of impact and outcomes on patient care, then that's clearly a very good starting point to work backwards, and we can resolve technicalities and challenges to help answer that direction of travel as much as anything. Still not seeing any hands, so I will start to draw this to a close. If there are further questions after this, the SDE email address is as part of the application. It's part of the chat today. The team are happy to answer any broader questions, any technical detail questions in the upcoming weeks until the call closes. Again, just reminding people that it does close on Friday, the 10th of July. I'll just come to Mark. Do you want to close the call and round off?
Sure.
Final
so
words?
Firstly, thank you very much, everyone, for your interest in attending today and all of the great questions. The SDE is a service. It's a service to exactly researchers like yourselves. We want to be of service to you. So we're super interested in your ideas, how you can make best use of the data assets that we already have, how we can understand that commonality of other data that we should have in the SDE for the benefit of researchers in future. So we're excited to receive all your applications. We're looking forward to reading them in detail. Thanks for spending the time filling them in. Thanks for attending the call, and looking forward to seeing them all in detail soon.
Thank you, Mark. Just one final point for people on the call that's come up in a chat is we are looking to build communities around this. We're looking to link people who have interest in using data and in certain areas of patient care. If there's anyone on the call who doesn't want us to share their email addresses with anybody else where we think there might be a connection, please do let me know. But we are keen to join people up and help that wider community conversation wherever we can. In which case I will close this call. Thank you all very much for your questions. We look forward to receiving your applications and to working with successful applicants in the future. Thank you very much.
Thank you.
Thanks all. Bye.
Thank you very much.
Bye.